Hi, it's Dr. Kevin Leach. Today we're going to talk about Meniere's disease and the research that strongly suggests a primary cause being the upper cervical subluxation complex. So if you have Meniere's disease, this video could literally change your life. Now, as you know, Meniere's disease is a medically named condition that affects the inner ear, usually only on one side, and its symptoms are debilitating. Some of the symptoms are a fullness sensation in the ear, tinnitus, a ringing in the ear, vertigo, which is a very strong form of dizziness, and this could actually lead to potential hearing loss. Now, a lot of patients with Meniere's disease actually have migraines as well. Now, some common medical treatments include diuretics to decrease the fluid buildup in the ears, some anti-vert for patients with the vertigo to decrease the vertigo, and steroids to decrease inflammation and symptoms. Now, I want to go over the research here that we have. This is a retrospective study. There were 139 patients in the study, and 136 of them got minimal to drastic improvement in their symptomatology. Now, right here it says in the results section, although all symptoms included in the questionnaire averaged lower scores at 6 weeks, 1 year, and 2 years, the vertigo and associated nausea and vomiting were lowered dramatically. And it shows here, for vertigo, averaged 8.5 on a scale from 0 to 10, where 0 was no symptoms, 10 was the worst symptoms someone could possibly imagine. And that was before. And now after 6 weeks, the average score went down to a 3 from 8.5. Then after 1 year, the average was 2.3. After 2 years, it was down to 1.4. And it actually says that many patients noticed an improvement before they left the office after their first adjustment. And that's pretty significant. It says 2 years after initiation of care, 88 out of 139 patients, that's 63%, reported a score of a 0 or a 1 on a scale from 0 to 10 as far as their symptoms are concerned. That's fantastic. That's dramatic. That should give you hope for getting to the cause of the Meniere's disease. Now, I also wanted to go over the mechanism of why this could be a potential cause, just to explain it a little bit so you understand exactly what's going on. And I have a model here of the skull. It's a cutaway of the skull, okay? And then you have the top two bones in your neck here. So a potential mechanism is the fact that your brain sits in here, inside of your skull, and nerves come off the brainstem, which is where the brain comes out of the skull, and they come back and they go actually into your head, into your eyes and your nose and your ears and your mouth, everywhere. Now, if you have a mechanical misalignment, putting pressure on those nerves, that's the atlas subluxation complex, the upper cervical subluxation complex. It could interfere with that communication between your inner ear and your brain, which can cause symptoms. Now, our job here is to precisely correct that misalignment, get the pressure off of those nerves to restore normal function. And that's the idea, to restore normal function, not to treat anything that's going on in the ear and the symptoms, but to restore your body back to the way it's supposed to function. And it's supposed to function without tinnitus and vertigo and fullness in the ears and all of those types of things. I wanted to share a quick story. One of my colleagues in South Carolina had Meniere's disease at around age 13, 14 or so. He actually had to repeat a year in high school because he missed so much school because of the Meniere's disease. Then he got an upper cervical adjustment, which is what we do here, and it changed his life. It gave him his life back, it reduced symptoms, and now it actually helped him so much. He's an upper cervical chiropractor in South Carolina to this day because of how much it helped him. If you've been diagnosed with Meniere's disease, call my office, make an appointment. You deserve to get your life back. You deserve to have a life where you're not concerned about the vertigo and you get wiped out for one to 3 days, and you have the dizziness and the fullness of the ears. There may be a little bit of permanent damage done, but we'll never know until we address it. So you may have this misalignment. Call the office, make an appointment, and I'm excited to hear from you. I'm excited to help you. This should really give you some hope. I look forward to meeting you. I'm Dr. Kevin Leach.